Today we are going to talk a little bit about menopause. But before we start, would you mind introducing yourself and tell us what you're doing here today?
Okay, so I'm Angie Rantell. I'm a consultant nurse in Urogynaecology and senior lecturer in physiotherapy in pelvic health, and here talking today about pelvic floor dysfunction and menopause.
And how can menopause affect people with MS, like with symptoms and things?
So firstly, I think it's important to say that menopause can affect all women in lots of different ways. And so it's not something that, we know menopause has an impact on women, either from vasomotor symptoms, so hot flushes, sweats, from the affective symptoms, anxiety, depression, fatigue, or from bladder symptoms, sexual health symptoms and vaginal symptoms. So it can really have a whole body, physical and psychological effect. When it comes to women with MS, the challenge is symptoms are often confusable with things that we would expect to see with MS symptoms. So trying to differentiate whether the fatigue, the anxiety is related to MS or menopause is a challenge. But we also know that the impact of temperature changes, the hot flushes, the sweats, can have a neurological impact and can suggest symptoms of disease progression or relapse, when actually it's purely hot flush related rather than relapse or disease progression. So it's a challenge trying to say what is because of menopause, what is because of MS.
And how important is it to because I'm thinking if you're living with fatigue, for instance, and you suddenly start feeling it's increased and you've just put it down to MS, but how important is it to actually question it and maybe approach a health professional?
I think it's very important to do that, especially at certain points of life for women. Now, it's very rare for women that when it comes to menopause, they would only ever experience one symptom. So if it is just one symptom, then it's unlikely to be that. But if it's in association with a combination of other things potentially, and women are within that time frame of perimenopause to post, so we're looking really from mid-40s potentially up to early 50s, then it's definitely something that should be considered, and a health assessment, which can be done either by a specialist or by GP, to look at other things, to maybe do a hormone profile, should be considered.
And can menopause affect relapses?
So there's very little evidence out there. There is evidence that if women get hot flushes, it can cause worsening of neurological symptoms and can mimic a deterioration in neurological symptoms that could be thought of as a relapse, but isn't. It's related to the hot flushes. But there's no... Whenever it comes to evidence for menopause and MS, there really isn't a huge amount of literature there. There's not been a huge amount of studies. So there's not really any evidence around to say that menopause causes relapses, that it impacts upon disease progression or anything like that. But there's not the evidence to show that.
No. Do you feel, because you worked for a while doing this, do you feel like we've gotten better at talking about this?
I think as a whole, women are getting better at talking about it. But I think in the past 3 or 4 years, nationally, there has been an increase in promotion around the menopause. It's been on the national agenda, it's been on the government and the political agenda. There's been lots of work being done. There are lots of TV programs about impact of menopause. There are lots of celebrities that have started talking about it, breaking down the taboos. So there is definitely a move to increase understanding, knowledge, promote and normalise symptoms and increase help seeking.
One thing that's often talked about is HRT. Could you sort of explain what it is and could it help for people with MS?
So hormone replacement therapy is basically a way of putting back the normal sex steroids that we're missing when we get symptoms. There are a huge variety of different types of HRT. There are systemic HRTs, which are either tablets, patches, gels that you take that give benefit for whole body symptoms, and there is topical hormone or local hormone replacement therapy that's just put into the vagina for vaginal and bladder symptoms. When it comes to the systemic, there are a huge variety of different ones. There's estrogen only combined, there's sequential, there's continuous combined. There are masses of different ones depending on individual people's situations, symptoms, health conditions, whether they still have their uterus or not. So it's a huge area, but there are lots of different options within it to find combinations that are right for each person.
So it's important to sort of go and talk to someone so you get the right thing.
It's about speaking to, for GPs will have the basic information, we'll be able to do the first line assessment, we'll be able to start things off in line with national guidelines, and then there are specialist menopause services that people can be referred into if their situation is more complex or they're not responding to the first line of treatments.
We sometimes hear that people who have approached like GPs, you know, we hear a lot about people talking about gaslighting and so on, that people don't fully understand. I mean, we're hoping now when we're talking much more about menopause that it's less of a problem. But if you feel like you've hit a brick wall, what should you do then?
So there's been a huge movement in the last couple of years nationally to promote impact of menopause, increase awareness, increase information. There are lots of national charities available that you can get in touch with that give advice. There are GPs are having increased training. There are national guidelines as to what to do. I mean, even within amongst these initiatives, one of the new things is the recognition that for women that need to be provide hormone replacement therapy, they get reduced cost prescriptions now. So if you pay for your prescriptions, you now only pay a reduced cost if it's for a hormone replacement therapy. So nationally, there are these guidelines, there are these pathways in place, and therefore GPs should have more information. But otherwise, there are all sorts of national charities that you can get in touch with that can help guide you. And also many workplaces now, there are movements and there's education for the management of menopause in the workplace. And so if you have an occupational health department within your work, they will all be able to provide you with access and help guide you to seek help.
Because is it true that quite a lot of people do end up almost wanting to leave work because of, or actually do leave work because of menopausal symptoms?
So for the general population, menopause itself has a massive impact on work productivity, absenteeism, ability to manage stressful situations and cope, and does result in a lot of people wanting to leave work, which is why it's been recognised and why there are now national packages of care for management of menopause in the workplace to help companies ensure they're providing the right support for women working within their companies.
Which is a brilliant movement, really.
Absolutely.
So people with MS have at a slightly higher risk of osteoporosis. Can menopause increase that risk?
Absolutely. So lack of estrogen is something that can impact upon bone health, and we know that people postmenopausally are more likely to develop osteoporosis. For those that are on hormone replacement therapy, that actually helps protect your bones and prevent osteoporosis. For those that either don't want hormone replacement or aren't suitable for HRT, then it would be looking at alternative things to prevent osteoporosis, to improve bone health, whether that be dietary, supplemental or prescribed things.
We sometimes hear about strength training being good for people with menopause. Is that something you would recommend? So
strength training is good for a whole lot of things. What we know is that it can help promote and improve bone health, muscle health. But actually, when it comes to menopause as a whole, exercise in any shape or form is beneficial, and the evidence shows that women that do about 2.5 hours a week of moderate exercise are far more likely to have better menopause experience and reduced symptoms and improved health as a whole compared to those that don't.
And would that be for people who's got perimenopausal symptoms as well?
Absolutely.
So get exercising.
Yeah.
Is there anything else that people with MS can do to sort of ease the impact of menopause?
So again, the health promotion things count for any woman, not just those with MS. So when we look at things to help promote and health, so again, it's almost the same as those with bladder symptoms. We know that eating a healthy diet, is very good to prevent symptoms. We know that maintaining a good weight and a normal healthy BMI is good because we know obesity has a significant impact on menopausal symptoms. Reduced alcohol intake. We know that if you have an alcohol intake of 2 or more units a day, you're more likely to have problems associated with it. So looking at a low alcohol intake, avoiding smoking, exercise. If you're having vaginal symptoms associated with HRT, sex is really good for you. And so, but again, that can come in with your exercise.
Yeah.
And so general health promotion, exercise, diet, lifestyle, other things that will help.
Brilliant. And if you are sort of a little bit embarrassed to talk about these sort of things, what's the best approach to get started?
So, as with everything, for women that don't want to open up initially, there are a huge number of helpful websites, patient groups online. There are all sorts of charities that have network cafes online, a whole load of information available online. So for those that don't want to open up in person to begin with, I would start by going by to the menopause charities and the networks available online, so therefore you can remain anonymous. And then once you're working through, and you may have tried some simple self-help, health promotional, simple therapies that you can get advice for online, if you're still not having things, then hopefully that may help you then, give you the knowledge of where to seek help and give you the confidence to do that.
Brilliant. Thank you so much.
Thank you.